Hi, I'm Dr. Brian Kaufman, a retired family doctor and a CLL patient myself, and the co-founder, executive vice president, and chief medical officer of the nonprofit CLL Society, a 501c3 that's dedicated to the unmet needs of the CLL community. And today I'm going to be presenting some important research that was recently presented at a major hematology conference, a major cancer conference. Mazi Sang led a group of researchers out of Mayo Clinic who presented their findings at the American Society of Clinical Oncology, ASCO's huge annual meeting in Chicago in 2023. And what was the bottom line of what she found on this paper that was titled, "A Study of Frontline Therapy in Adults Greater than 80 with Chronic Lymphocytic Leukemia"? What she found was, in those over 80, and remember the average age of diagnosis of CLL is around 71, 72, older age and not being treated with a novel agent frontline were associated with increased mortality. The leading cause of death in this group was the CLL itself. What's the background here? We know that the average age at diagnosis is about 71, but we know that those over 80 are underrepresented in clinical trials, and there is less data on how they respond to therapy. So this research was to help look at that group and how they do. What were the methods and participants? The Mayo Clinic leveraged its CLL database. It was interrogated to study those equal to or over 80 at the time of CLL frontline therapy between January of 1995 up to November of 2022. Overall survival, time to next treatment, and cause of death were studied. The study period covered periods before and after the introduction of novel therapies. Let's dig into the results. Mayo found 216 patients with CLL 80 or over at the time of initiating frontline CLL therapy. The median time from CLL diagnosis to initiation of therapy was 3.1 years. The median overall survival after starting frontline therapy was almost 4 years. The median overall survival was 3.3 years for those who used chlorambucil-like medicines, alkylating agents, which is a kind of chemotherapy. It was 3.8 years for those who used purine analogs like fludarabine, the F in FCR, another kind of chemotherapy. It was 3.9 years, see how these are all quite similar, for those using antibodies, anti-CD20 monoclonal antibodies like obinutuzumab. But it has not yet been reached. The median overall survival has not yet been reached on those who were started on novel agents. The type of novel agents included in this study were 19 patients on ibrutinib, 16 on acalabrutinib, 7 on venetoclax, and 1 patient on an experimental BTK inhibitor. Overall survival for the 36 patients who received a BTK inhibitor, the 3 that were used in this, compared to the 7 who received venetoclax, was very similar. At a median follow-up of 6.7 years from the first visit, 143 patients had died from the following causes. 63 had died from progressive CLL, 12 from infections, 11 from other cancers, and 21 from unrelated reasons. The cause of death was not available for a full 36 patients. Older age, so a 5-year increase. If you were between 80 and 85, you were at lower risk of dying than between 85 and 90, and between 90 and 95, you were at higher risk than 85 to 90. So every 5-year increment was associated with a 50% increased risk of death. Treatment with non-novel agents was associated with more than a 3-time risk of death. Of the 216 patients studied, 76 required second-line therapy. The median time to next treatment was 4.2 years. So what can we conclude from this important retrospective study? The novel agents, such as the BTK inhibitors and venetoclax treatment, when used in frontline, are associated with significantly improved overall survival in patients with CLL who are over 80 years old. This is not surprising because we see the same thing in much younger patients. There's one thing that the authors didn't bring attention to that I want to bring attention to. The fact that 44% of these elderly patients died directly from progression of their CLL belies the often told maxim, you will die with your CLL, not from it. If that's not true for nearly half of those in their 80s, how much more untrue is it for someone diagnosed at a younger age? If you want to read the full details of this 2023 ASCO article and see the tables, we have a link to a study of frontline therapies in adults 80 or older with chronic lymphocytic leukemia or CLL. Thanks for listening. Stay strong. We are all in this together.